It's early this morning and I've been reading through some of the comments you've been leaving. Peter Hartley says, a quibble. And it's not the first time you've said it. You have said the Home Office should employ more civil servants. That seems to be the regular call. Ever more staff in an ever larger state. Perhaps if they were seconded from other departments which have no useful work, that might be acceptable. You know, I wholly agree with you, and in fact, I think I've probably said something fairly similar in the past. The problem, or the context, is the asylum backlog, as of June 2023, around 175,000 people awaiting initial asylum decisions. About 91,000 were part of the legacy backlog. Those claims were made before the 28th of June 2022, and a further 84,000 had more recent claims. By early 2025, nearly 30,000 asylum seekers were still housed in over 250 hotels, costing the government around 4.2 million daily, going up at various times to 8 million. Across the system, including appeals and pending removals, the total backlog now reaches approximately 224,742 claims. Appeals have surged. By the end of last year, nearly 41,987 rejected asylum seekers awaited appeal outcomes. That's a 500% increase over 2 years, straining the system further and costing nearly £1.5 billion annually. That's not unlike what's a slave in plebs, Dromio or something? Dromio straining to stain his master's tunic. The staffing gap here, to clear the legacy backlog by the end by the end of this year, the Home Office would need, well, by the end of 2023, they would have needed 2,500 extra case workers, up roughly 1,600 in July of that year. The target, that target apparently was achieved, but new staff require a year to become fully productive. Now that number must have more than doubled. No publicly available figure specifies exactly how many additional civil servants would ultimately be needed to clear the current backlog, including new claims, appeals and removals with steady performance. But, you know, if the NHS England is going to be abolished, then maybe there are a number of civil servants lurking around who could be repurposed. On the 13th of March 2025, the Prime Minister announced the abolition of NHS England, citing excessive bureaucracy and duplication with the Department of Health and Social Care, that's the DHSC. And Health Secretary Wes Streeting described it as the final nail in the coffin of the 2012 NHS reorganisation, and argued that the integration would free up cash for frontline services and speed improvements. The abolition is to be enacted via primary legislation, and the completion of integration into DHSC is expected within 2 years. What Wes Streeting doesn't say here is that under the current regime, it's not possible to sack somebody from NHS England. If you sack somebody from NHS England, or if you sack someone from NHS England, they have to be given another job. They have to be offered another job within the NHS or within the civil service. So that clearly gives us an opportunity. So at the moment, this NHS England abolition is simply a bureaucratic sleight of hand that actually is not going to do anybody any good. It's rhetoric rather than reality. The aim is to cut staff numbers at NHS England by around 50%, thereby saving hundreds of millions of pounds. It won't. Health think tanks, unions and analysts caution the probable disruption, the diversion of patient care and the illusion of savings, particularly given that principle that NHS staff have to be offered another job. Well, it's very simple. They can be diverted immediately. And this is where your proposal steps in. Leveraging the excess staff capacity from NHS England, who cannot be made redundant without redeployment to address the asylum crisis. Specifically, second NHS England staff to the Home Office, assigning them to help process asylum claims and reduce the backlog. The potential benefits, there are three. Value for money, reducing overhead from duplicated administrative layers in the NHS and redirecting those resources to a critical national problem. Relieving the Home Office by providing trained and trainable civil service capable personnel, and rewarding frontline public service, giving purpose to staff displaced from bureaucratic roles. We could end with a rhetorical flourish there, couldn't we? We could talk about the CEOs of the NHS trusts. The so-called overpaid executives might finally undertake real, tangible, value-added work rather than internal posturing in their offices. This is the dual crisis of obstructive bureaucracy in the NHS and the asylum backlog that threatens national finances and human welfare. Putting these two things together solves a problem. It solves a problem, and it's something that it's something that we ought to race towards, not just simply accommodate. We should be racing towards this redeployment of NHS of irrelevant NHS staff, and it's I think it would do the entire country a lot of good, and Blackpink would have something to sing about. Are you familiar with Blackpink? There's three: Rosie, Jenny, Lisa. I can't remember the last member of Blackpink. This is a K-pop band. You could imagine if Wes Streeting isn't going to remove people from NHS England, maybe Blackpink can just turn it up to full volume and then all get out.